This is also a subset analysis of the fusion trial that I talked previously about. This is, as a recap, this is the combination of the avelumab, the anti-PD-L1 inhibitor, plus azacitidine compared to azacitidine monotherapy in older intensive chemotherapy ineligible patients with AML or higher risk MDS. And what's especially in MDS been recognized more recently is that there is that TP53 mutations have generally an adverse prognostic implication, but that the prognostic impact varies by the specific subtype of TP53 mutational status. So there, for example, there's data that shows that bi-allelic TP53 mutations are what's actually driving the adverse prognosis, while patients with a mono-allelic mutation tend to have a more favorable prognosis. But however, the data is somewhat conflicting, and that's why we conducted this post-hoc analysis, trying to use the randomized design to also limit any potential confounding that's otherwise seen in real-world analyses. So we then used two different methods to assess allelic status. One has been recently proposed by the International Consensus Conference, or ICC, this year, and the other one was published by Grope et al. This year in Blood. And what we could then see is, yes, TP53 mutations confer an adverse prognostic, have an adverse prognosis compared to TP53 wild-type status. However, there was no difference really in terms of mono-allelic versus bi-allelic status, neither in AML nor in MDS patients. So this adds to the literature, and I think there's just more analysis that's needed to really reconcile those different results from the various studies. Yeah.